In 2015, the DC Department of Health implemented a plan to combat the HIV epidemic. In this plan, the DC Department of Health outlined three major goals. The first being for 90% of district residents to know their current HIV status. The second being for 90% of those who are currently HIV positive to be on a sustained HIV regimen. And the third being for those who are currently on a sustained HIV regimen to be virally suppressed by 2020. And with those three benchmarks met, the DC Department of Health estimated for there to be a 50% total reduction rate of new HIV cases in the district. However, due to the effects of the pandemic on HIV treatment and prevention resources, and the disruption of care in some HIV patients in the district, these goals have not yet been met. Now that we have made some headway in combating COVID-19 as a nation, it is important that we, as the only pharmacy school in the District of Columbia, do our part in bridging the gap of care in HIV patients post-pandemic, especially as a historically Black institution, because the effectiveness of any HIV combative initiative will have to center Blackness and racial inequalities in its response to end the spread of HIV.
In 2020, around 14,000 people were recorded of having HIV in Washington, D.C. That number equates to a figure of 2,260 per 100,000 people. In 2019, the national average alone was 12.6 per 100,000 people. Based on these two numbers, D.C. has HIV cases around 180 times more than the national average, making it an important issue for us here in the district. Nationally, African Americans made up 44% of newly diagnosed HIV infections in 2019, disproportionately higher than their total representation in the United States. And Black women are 15 times more likely to be diagnosed with HIV compared to white women, and 5 times more likely to be diagnosed with HIV when compared to Latino women. Now, for women who are HIV positive, a major aspect of their health that can alter their course of treatment or urgency for treatment of HIV is their pregnancy status. HIV can be spread from a mother to her baby during pregnancy, delivery, or from breastfeeding. In the absence of intervention to treat and manage HIV in a mother, the rate of transmission of HIV from a mother living with HIV to her child ranges from 15% to 45%. So it is important for the mother to see the doctor for blood tests, prenatal visits, and to be prescribed the necessary antiretroviral drugs necessary to combat HIV for both the mother and the child. In addition, the stress associated with living with this serious condition can affect a person's mental health. People with HIV have a higher chance of developing mood, anxiety, and cognitive disorders, with depression being the most common mental health disorder faced by people with HIV.
To make an impact in our community, we will be partnering with a women's health shelter in DC in order to provide education on HIV prevalence, HIV prevention, HIV PrEP, and HIV testing. As we all know, being diagnosed with HIV can have a great impact on mental health. For this reason, we will also educate them on the importance of mental health while guiding them to mental health services like Pathways to Housing DC. This is a program to end homelessness and support recovering people in complex health conditions. As the HIV population in DC ages, providers are spending more of their time treating HIV patients for conditions faced by many older Americans like hypertension, prediabetes, diabetes, and high cholesterol. So in addition to the HIV educational and testing services we will provide, we also will be providing general health education on cardiovascular diseases, as well as blood glucose reading, blood pressure measurements, COVID vaccines, and nutritional tips. We will be providing educational posters, pamphlets, condoms, and we will also invite some of our professors to educate the community on these disease states. Our overall goal is to spread awareness for HIV, help reduce its prevalence in the African American women in the Washington, D.C. area, and help medicate cardiovascular diseases that may impact our HIV patients for them to have a great overall quality of life.